Almost all of our behavioral health patients come to us through the emergency department. They can be referred from a school, a physician's office, or even the police department. And sometimes patients come to us themselves. Symptoms are diverse and often include behaviors that are likely to cause the patient or others serious harm. During triage and following a physical examination, patients receive a full psychosocial evaluation. In addition to our team of psychiatrists, specialized pediatric telepsychiatry through Mass General Hospital is available if necessary. We are the only hospital in Massachusetts who currently has this type of pediatric psychiatry collaboration with Mass General. Treating patients who are experiencing psychotic episodes or thoughts of suicide, along those who have physical illnesses, is never simple, and the pandemic has raised that degree of difficulty exponentially. As you heard from Chris, the number of behavioral health patients has increased, some age groups dramatically. That means that there are fewer psychiatric beds available throughout the state. When we deem that a behavioral health patient requires hospitalization, we must board them in the emergency department until we find them a bed. In Massachusetts, there are 2,717 psychiatric beds, and only 340 of those are for patients under the age of 18. It is not unusual for some of these beds to be non-operational due to a variety of reasons. So sometimes the wait in the emergency department is long. In fact, we recently had a pediatric patient board with us for nearly 180 hours. That's more than 7 days. Even if a patient does not require hospitalization, they remain in the emergency department with us until a treatment plan is put in place. Imagine being stuck in a 10 by 10 room with a security guard or a nurse constantly watching you. There's no real stimulation. There isn't even medical equipment to look at because in our 2 behavioral health bays, they are hidden behind sliding garage-style doors, so patients can't access anything that they might use to hurt themselves, such as a cord. Patients aren't allowed to have cell phones, iPads, or laptops because of the possibility that they could break the screen and use the glass as a tool to harm themselves or others. What has been increasingly apparent to us is that the importance of keeping patients calm and safe is difficult. Not only is a patient's level of calmness often correlated with the degree to which they are occupied, distraction can also prevent a patient from harming themselves because their thoughts have a place to land other than the dark corner of their mind. Among the things that we think would greatly improve behavioral health patients' experience are safe televisions. TVs would be attached to the wall and encased in plexiglass so that patients could view the screen but not access it. In addition, we believe that coping kits that we're calling anchor bags, specifically geared to behavioral health patients, would go a long way in providing some much-needed comfort. These items might include a deck of cards, word search games, pads of paper and markers, as well as calming tools such as cards with breathing exercises. These kits might seem like a very small band-aid for a very large issue, yet we believe they will provide an important and in fact critical comfort for our patients on their behavioral health journey. We appreciate your financial support of our work and thank you. And now, I'd like to turn our virtual floor over to Dr. James Evans, Director of Behavioral Health Services, who will share with you some of the ways the auxiliary has already helped the Behavioral Health Department, as well as their current needs.